I passed my 2-month post-op mark yesterday. It's 23rd of August 2015 today. I had a liposuction procedure with Mr. Peter Neeshaw at Castle Hill Hospital in Hull on the 22nd of June 2015. So I've got a few updates to show you and show how everything is. I'm a lot more settled about how it's looking now. It's not 100% as flat as I thought it was going to be. I think it's just because of the procedure that I had. It's different to keyhole procedure. Give you a few updates, being post-op now, 2 months. I'm no longer wearing the surgical bandage that I had to wear post-operatively. I had to wear that for 6 weeks. For the first week I had to wear it 24/7, which was hell. For the second week I could wear it for 12 hours and take it off, have breaks, wash it and whatnot, and then for the remaining 4 weeks I just wore it in the daytime. The reason for the bandage was I didn't have any drains, but obviously there's still going to be swelling there, so just to help with compression with the swelling, it did help. As much as I absolutely hated wearing it, it really did help with the swelling. But I'm no longer wearing that. I stopped wearing that about 2 or 3 weeks ago, so I am now just wearing t-shirts. Going back to not feeling like I'm 100% flat, I'm a little bit self-conscious that I have a chest still. It's getting my head around that I don't have to wear a binder anymore, that I can just wear a t-shirt. It's difficult to get into that mentality. I can just put a t-shirt on now and not have to worry about it, and I don't. It's just me being a bit, that's weird, after wearing a binder for 8 or 7 years. My stitches have fallen out. I'll show you in a minute, but the stitches fell out on their own. It was a little bit uncomfortable because they just kind of worked their way out, but the incision holes, if they heal as well as my hysterectomy incision holes, you won't be able to see a thing. One other thing I want to touch on, which is a bit weird that I need to bring up with Mr. Neeshaw when I see him next. My nipples are reacting differently. This side is reacting slower to temperature changes than this side, and I'm wearing a t-shirt just for now just to see if I can catch it. It's very bizarre. I don't know if it's a nerve damage thing or what, but I am due to have nipple resizing done when I next go and see Mr. Neeshaw. I will be scheduling that, but without further ado, I suppose I should show you how everything's looking at 2 months. So this is where we are at for 2 months post-op. Pretty happy, to be quite honest. The swelling's gone down. It's starting to look a lot flatter than it was before. That's that side, and that side, that side. This side's a bit flatter than this side. This is the problem side. This is the side with the nipple that I don't think is reacting very well. It's behaving itself now, but it wasn't before. I also, and I think I pointed this out in my other video, it feels like it just feels like there's extra tissue just being left over, just in this side, just in this area here, and it's not sore anymore. It's just like a mass there that isn't on this side. But yeah, that's what we're looking at. I'll show you my incision. Let's get that down a little bit. So that's my incision hole there. Oh shit. So we've got that one there, and it's quite flat. It's not sore, and that one's doing a little bit better. But yeah, I think once they've healed up, you're practically not going to see anything. So that's what we're looking at for 2 months, which I think is quite good for 2 months. I'm quite happy. I suppose the next update I'll do will probably be when I next see Mr. Neeshaw, which should be coming up soon. I'm sure he said sometime in September or October. But I'll keep you posted, and obviously I'll make an update video. But yeah, everything is good, and I will talk to you all very soon.